Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Well, good morning. Happy New Year.
Good morning. The same to you and everybody out there who always listen to you, and you give everybody such hope for 2016.
Happy and healthy and wonderful well-awareness full of, for this new year for all our listeners and to you and I and Richard.
Yes, everybody, your family. It is a good time. You know, people were so scared during they didn't want to go out on New Year's or afraid of terrorism. I'm never afraid of that. Are you?
No, I don't let that.
Either.
When
fear.
When you lack yourself, then you know, they are winning the battle.
Yes.
You know, I mean, we should be so grateful to our, intelligence, department, our, police and firemen and all the people that made us safe, you know, for people to be able to go out and enjoy themselves.
Dr. Mencia, but
you know, a lot of times we don't even think of them, you know,
no,
but look at New York City, the amount of police forces that went out on the street just to make sure there was a safe.
There are 1 million people in Times Square.
So you can have
happened.
some stupid terrorist living in an apartment in New York, but they were probably scared to their pants to go out and do anything because they knew that on the opening the door, they were going to get a bullet between the eyes.
There wasn't any, but of course, Brussels and Paris closed everything down. They let them win. I'm sorry about that.
Yeah. Well, Paris, you know, they just lost all these people. So whether they let them win or they show respect to mourn, you know, the recent loss. I don't know.
Well, I
it
think
was so recent for them to celebrate. And I could understand that, you know.
Well, but I hope it's not fear. You know, I don't live in fear.
I hope it's not fear. Absolutely. We cannot live in fear.
I don't live in fear. And I've always said that if you're a fearful person and you
are a loser.
And I think that you do is you take that negative energy and you attract other negative energy. Am I right?
Exactly.
And you've been very much into Eastern thinking, and I was thinking about that.
Absolutely. You know, and we were just talking before going in the air, people being diagnosed with cancer. You know, how do you fight it? You know, you fight it with positive energy. You know, not with negative sadness, because all of those things that slow down your immune system will kill you faster. So while you are dealing with the cancer, you know, fight it with positive energy and bring positive people around you.
I have heard there was a book where someone watched movies of lots of fun things that comedians, and when they were very sick, and that's how they got through a lot of that.
Yeah, I want to make a parenthesis. Last week we spoke about our dental department. We just obtained a new equipment, it's state of the art. And it will do crowns in a day. So when you and I were talking last week, last year, we were saying that if you are going on a cruise or anything like that, well, guess what? One of the listeners or a friend of a listener, that the guy was going on a cruise. Hey, Dr. Mencia just said that they are doing crowns in a day, and both offices are open. They live in West Palm Beach. Both offices are open. We can go they walk into the Boynton office. They put us to the test, Anita.
And you were able to do that?
We did the crown before he went on his cruise. I was so proud. I said, okay, my staff didn't let me down.
Well, that is unusual.
But that is so state of the art. You know, when you go, and I'm sorry we switched subject.
No, I'm glad you did.
When you go, you know, you're going on a wedding, you're going on a cruise, you're going some kind of activity, and you need a crown. Like this guy was one of his front teeth, so when he smiled, it would be noticeable. So of course he had to do something. But when they do a temporary crown, the color and everything is not the same as the rest of your teeth. And this person already have 2 crowns, so it have to be matched perfectly. So, it was so beautiful to be able to do while he was there, he went to walk in the mall, in the shopping street there, came back, and when they put a crown in, it was a final crown. That's it. You don't have to wear it temporary, that the color is different, nothing like that. Wait for 2 weeks.
Or it can fall out.
It can fall out because it's a temporary, because the temporary, you don't glue it like you do a final. A final, you put, the real glue so it stay. Temporary have to come out so you can put the final. So a lot of time the temporary will come off when you're on the cruise or something, all in the wedding, and you cannot smile.
So tell me why it was the other way. Is this just new equipment?
It's still the other way. Just, dentistry keep evolving by the day. And it's a new equipment that, just came out. Very few dental offices has them. We are, blessed to be one of the few in South Florida to have it. And, everything is computerized. So you take the impression, you put it in the system, the equipment go and make a scan of the impression. And when the machine just start working and start cutting, moving. And, it's like, have you seen those machines?
The IBM printer.
The IBM printer like that, exactly. You've seen those machines that you go, you ask,
you can make your own little something.
Exactly.
Your own little hand or something.
Exactly.
So that's what this is like.
Exactly.
It's all computerized.
It's all computerized.
Well, I think we should write an article in, for January on the, her crown, queen for a day. This is crown for a day.
And then, for this person, because he was going to go, usually we want to do it within 24 hours just to make sure we do a great job. You can do it within 2 or 3 hours. So I told the staff, because we've mentioned this person is going on a cruise, like put priority on this and do it fast. So they did it within a few hours, and he was able to go on his cruise with his crown.
So
he was calling to say how grateful he was about that.
I'm really glad to hear that, but I was thinking, it's not everybody, though, knows how to do these kinds of things. Even you buy the equipment, and you have really gotten yourself some fantastic prosthodontists and dentists.
Exactly. We have the specialists that work there. And as a matter of fact, one of my assistants, unbeknown to me, she used to work when this equipment was first coming out. She used to work with the equipment, the old version. So I sent her to Texas, with the manager, Mike, that you met here at the show. Dr. Rosemary went to Texas. So a small group went there to Texas to be trained. So they went there, they got trained, they came back, and they are all gone home, sometimes.
So it took special training and special equipment to do this. Well, I think we ought to that is an extraordinary thing for you as a physician.
It's
now
breaking,
it is.
Yeah. It's like you go and you don't have to wait that long to be taken care of. Now you can have your teeth, done immediately.
Well, because it's temporary, right? When you have to have the mold, and then you have to send it away.
Right.
Then you have to wait to come back, and if it isn't right, they have to send it away again.
Exactly.
So it could be 3
and because
weeks.
it's not been done on the premises, every time they send it out, you're talking about at least 4 to 7 days before you see it back. Because then it goes and then it get online with all the other work they have to do. Where this one is just right then and there, you try it on, you need to fix anything, you put it back on the computer, tell the computer what else need to be fixed, and it's amazing.
Is there a word for it? Is there a name or something that it's just crown in a day, right?
It could, again, we can really, once we are well organized, we probably can do it within half a day. 2 to 3 hours. But I told my staff, I don't want to overpromise and underdeliver. So I said, let's say within 24 hours. So, God willing, person coming early, we are able to produce the crown, but I don't want to hold the staff there until 11 o'clock doing crown. So If they come really late, then they're going to have to come the next day.
And that's for one crown. But if someone wants to have more crowns...
As many crowns as they want. Each crown just get produced. It just, get produced in the machine. So as many crowns as they need, they can have a whole mouth of crown done in a day.
Okay, so do you see this system getting out of the dental world helping you in the medical world when they're going to have computerized things like this? I mean, I can't even think. I mean, for instance, I know someone who has carpal tunnel right now, and she's going to be operated on. And I know that lasers are now coming out that can really help the carpal tunnel. Exactly,
yeah. A lot of equipment also in medicine are coming out to help us. People that are having problems with their feet, they're injectable, that it's coming out so you get more cushion on the sole of your feet.
Oh, that's me. So, I need that. So tell me about that.
Well, it's a collagen stimulator. Just like the one we use for the face to rejuvenate the face.
Collagen stimulator.
It's a collagen stimulator, and they put that and then basically just rebuild the sole of the feet so you have, enough collagen to lift up. The fresh frozen plasma, PRP, is being used a lot in joints and a lot of those things that are holistic. Unfortunately, we don't get the government to be so supportive. It's interesting when I go to Germany how the attitude in other countries, how receptive they are. You will save so much money if you allow, if you support a holistic approach to care. But I guess the pharmaceutical company and everybody that is lobbying for their product have more power than Mother Nature.
That's why a lot of people go other places for these operations.
Exactly, which is horrible. I mean, I really hate to see that. I'd rather, and I have some training on PRP, and I hate to see a person having to go to a third world country. I remember being in Mount Sinai, New York, and we have a lady that went to get treatment. I think it was Ecuador or something, one of the South American countries. She came back with such a horrible cellulitis, she almost lost her leg. So we put her in, multiple antibiotics, trying to salvage her limb. And we were able to, but it cost a lot of money. Where if she would have had the same procedure that she went for, she would have had it done here, it would have been, we have, as a nation, right, on that one patient, we could have saved so much money.
What's interesting, Dr. Feinerman is coming in, and he's going to be talking about stem cells. And there's some, just as you were saying, some things the government's allowing, but other things he has to go over to Peru and other places to do the same thing.
Right, which is horrible. I mean, come on.
Because now you don't have, well, of course you have your same doctor, but you don't have the same...
Right. If you want to help the economy, let the people come to us so they can get treated here.
What is it that the government, but let's just ask.
I think it's the lobbying,
Well, you think it's strictly
it's politics, of course.
It's always been that.
Of course, it's always been that way, people with the power, that have all the investment in the pharmaceutical company, Look at this guy that took the HIV drug.
Yeah, right.
And took it from penny to 700% increase.
Well, he's no longer around. I think they've really gotten him on a lot of stuff now.
Exactly.
That was his problem. But that really is a big thing with pharmaceuticals. Well, let's get into that with your patients then. So let's say that you prescribe drugs for them. I know that you try to do everything else, but you prescribe drugs. How do you know which ones are better than others? I mean, you're not taking them yourself.
Because of my research and my understanding. And, thanks to you and I doing this radio show, as I do my research to come and see with you and educate the people, I educate myself. So when I read about, let's say, a genetic drug, if you study the genetic drug and how they are produced, the drug when it's brand, that means a pharmaceutical company owns it, and they have to abide by the rules and regulation of the FDA. And they get inspected, and they are, by law, they have to take X number of pills that they have produced and test them to make sure that the concentration they are claiming to have is there. So it's a lot of money that goes there to make sure that you have that kind of quality.
With a generic drug,
once you go generic,
is it the same?
Well, no, now it's a open hunting season. Anybody can produce generic, meaning that if you live in India or Haiti or Mexico or Russia or whatever, or, China, you can go ahead now in the backyard of your house if you have all the equipment and the knowledge. And then, if you have the know-how, you can just sit down and start producing thyroid medication.
And no one checks on you?
Well, then you get the capitalism that we live in. So the big pharmacies, the big chains, not the mom and pop pharmacy, but those big chains out there, they will see who's going to give you the best price for those thyroid medication. Because let's say one pill of thyroid medication, just to say a number, the consumer is going to pay me $15 for one pill. If I buy it from the brand company to produce it, and it costs me $10, I'm making a $5 profit. If I buy it from a third world country and it costs me 1 penny, I'm making $14.99 profit every pill that I'm selling. So I'm going to go ahead and see who's selling it cheaper this month. So this month could be India, next month could be China, next month could be Mexico, next month could be Haiti, next month could be Dominican Republic. Whoever is doing it cheaper, who's providing me the drug that I need for the following month at the cheapest price.
Yeah, but who watches them that they're doing the right drug before it comes in here?
Their country is responsible for that.
You're kidding.
Yes.
I never knew this. This is really, well, one thing I don't know.
And then you have, when you get product that comes from third world country that are not regulated like we are in this country. People can sell you powder as a fake pill that can be harmful to you.
I'm sitting here, I wish it were television, with my mouth wide open because I can't believe this. So that's why we all go to AGI Medical and Dental Centers. You hear Dr. Mencia every Saturday morning, and you understand why his practice is exploding, because so many people have no idea about what we talk about here, and now they realize they've got to go to someone like Dr. Mencia and his other specialists. So let me give you some information so you can do that. It's called AGI, which really stood for Adult Geriatric Institute, but it's okay. Now we've shortened the name. AGI Medical and Dental Centers. The main office is in the Fort Lauderdale, the main center, and it's on Commercial Boulevard. All their offices are now open on Saturdays, which is exciting. The number to call for an appointment in Fort Lauderdale is 954-489-1345. 489-1345. And the one in Boynton Beach is 561-270-6494. Home visit services are available for homebound patients. And wait, very, very important that you hear this. You can go now and get a crown in one day. You heard that before. But you can really see Dr. Mencia and his staff on an emergency basis pretty much without an appointment. It's always better to have an appointment, but if something's really upsetting, it's bad, you just don't wait and go to one of those urgent care centers. Go to Dr. Mencia's offices, medical and dental. The website, and there's lots of YouTubes to see Dr. Mencia talking about a lot of the things we've been sharing here, is agifl.com. agifl.com. So,
and the dental offices are open on both sides.
Yes.
Boynton and Fort Lauderdale.
Terrific that you're doing that. Something you've been just talking about with pharmaceuticals. I remember I had a friend who was a pharmacologist, and he said to me, if you can afford it, always buy the actual brand. The brand. He said, because he mentioned a particular drug, and he said, it's almost exactly the same, but it's one little thing they leave out.
Right.
And so I've been really a stickler for that. So how do you
then
determine what to do?
Imagine if you're taking a medication for your thyroid and you think you are getting X microgram a day. But if you're getting it this month from some place that is giving you half of those micrograms, you're really taking half of the dose. Or if they are giving you an excess amount, then you can develop the side effect of excess amount of thyroid medication. You know, one of the medications that had been generic for years is digoxin, that is used to control the patient's heart when it goes into atrial fibrillation. And the dose is very precise. So when it went over the counter, sometimes you get patients that we started calling, oh, you are a digoxin failure because you failed the drug. It's not the drug failed you because they were giving you the wrong dose. When they look at the pill didn't have the concentration. And digoxin, just like thyroid, just like Coumadin, is double-edged. Too little will let your heart go into palpitation or go back into atrial fibrillation, lose control of your rhythm. And too much can be toxic for your heart. So it's like Coumadin. Warfarin is the generic name. When you take warfarin, it's a blood thinner. But if you take too little, when we check the level, then the level is going to be low. That means that you're going to be prone to producing clots. But if they are giving you a dose that is too high versus the concentration that was prescribed, then your level is going to shoot up and you can bleed in the brain, you can bleed in your belly, you can bleed in your lung. Because you're taking too much.
This is frightening.
It is.
So
frightening.
will you try to always recommend the actual drug and not the generic, or?
I educate my patient, because everybody have their economy and their situation that they live by. Some people live, with a retirement check and they have certain responsibility. And, my patient, they talk to me, say, my kids got divorced, so they moved back into my house, and it's really hard on me. And sometimes we try to be helpful. If the kids are taking medication, what drug is it? Let me see if we have samples so we can help you out, so that she or he doesn't spend their money in the kids, taking care of adult kids living in the house. So we try to educate the person and let them know, like, my first choice, I say, I'm an MD. I can write any drug I want to. But if you want to try, and this week I have a few patients like that, I say, if you want to try, come and see my dietitian. Let's work on a diet. Let's work on exercise. Let's work on this. Let's see if we can get things done without a prescription. And sometimes you get those patients that say, no, you got to give me something. Give me a drug. No problem. And then I educate them. You're going to pay a little bit more. Your copay might be a little bit higher if you take a brand, but you're getting a better drug. If you go with the brand, less side effect, you're getting better drug and you're getting, better results. If they say, no, I can afford it, just give me the cheapest thing you can find out there, then, sometimes I even send them to some of the, pharmacy that will give you generic for free. There are pharmacy out there. They will give you the generic for free. So if you get antibiotic or you get some of the generic drugs, they'll give it to you for free. So,
well, I have to just say that it's a very big issue, and having a doctor who understands.
So you know how cheap it is when they give it to you for free.
Yes. But what I like is that you do understand these drugs, and you do know what you should tell a patient.
As a doctor, I feel that we have what we call, and we have said it before, the biopsychosocial aspect of medicine. So the biological aspect is what we learn in school. How we learn about how the heart works, how the kidney works, how the lungs supposed to work, how they interact with each other. The psychological part is what you were saying before we went on the air. Well, if I have cancer, how does that affect me? If I'm told that I'm a diabetic, how will that affect me at work? What is that going to do to my marriage? What is that going to do to the rest of my life? So you have the biological, the psychological, and then the social component. What is more affordable to me? What is the best thing for me to do? What is the best insurance for me to be able to take care of my health? And all of those things play a part. And a lot of times, us as consumers in healthcare, we cannot see beyond our nose. So you get these people that can easily afford a good insurance, and they go with an HMO. And then suddenly, they get sick, and they say, oh, doctor, you have to help me, get me the best. No, I get you the best your HMO would allow. Oh, can I switch? No, you cannot switch now, because now you have the condition. So you have to look beyond your nose that, when the time comes that you need the best doctor out there, that we put the best team together, like that lady you met in the waiting
yes,
area, that have the
with
cancer.
And we're going to have her on the show.
With the cancer.
Yeah.
We put a team together that she still follow with them. And it's been over 5 years, and that she have survived breast cancer. But we put the team together that when she came to me and said, doctor, I'm so scared I was just diagnosed with breast cancer. And I told her, don't you worry. We're going to sit with, first you have to be positive. You have to have a positive attitude. So until they tell us that this cancer is all over your body and there is nothing we can do, you have to have a positive attitude. If they say that to us, I'll be honest with you, and I will be frank and open. But until I hear those things, I don't want you to come with this crying attitude and negativity. I want you to be positive. I want you to leave this room with a smile, that you and I are going to fight this thing together.
Yeah, well, I love that. And she was a fantastic woman, as a matter of fact, and we are going to have her on the show. But I do, it's funny that you should...
They will put her on the TV show.
Oh, yeah. We're still talking about that, Dr. Mencia and I. We've really, for those of you who went to the Cure Symposium and you heard Dr. Mencia, he was such a star. He was such a presenter. I mean, he speaks wonderfully, but when you see him kind of dance around and do his thing, well, it was really, really absolutely wonderful.
Spin on my head.
Yeah, right. You do it. Well, Dr. Mencia, you, I guess, is Dr. Feinerman? He's not here, is he? Okay, well, I know you have to get to your patients, so I can't keep you here. Too bad.
I know.
That's okay. I'll just go ahead and I'll figure something else out because I know you have to go. But thank you for being here with us.
Thank you, Anita, and happy 2016.
Yeah. Well, I'm always happy because you're here.
Oh,
it makes my life better.
Same here.
Thank you so much. Okay, well, we'll be right back. Just stay with us. Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.